Welcome. My name is Rebecca Gokert, and I am the director of the Evaluation Capacity Network and a professor in the School of Public Health at the University of Alberta. I want to welcome you to our Lunch and Learn session today, and thank you for taking time out of your day to join us for the next hour. Please know we are recording the session. You would have heard that alert just now, and it will be available on our YouTube channel. We'll send out a link after the session. I'll start with just some general housekeeping. So we have a number of registrations for today's talk. So in order to make sure that our technology runs smoothly, we're disabling your microphones and your cameras. We will spotlight the presenters during the question and answer period so that you shouldn't have to make any adjustments to your screen. And we do have a support team in the background, so please hold tight. If we have any unexpected interruptions, our team will do their very best to promptly address any issues. Okay, so moving to our next slide. So I want to start our time together today by recognizing and acknowledging the land we're meeting on. I know there are people on our call. We had a welcome from Red Deer, and we've got welcomes from across Canada. So you are joining us from various geographical locations, and you may reach across the traditional territories of many Indigenous nations. Honoring the land we are on and the footsteps that have walked these lands before us grounds us and acknowledges the importance of relationships. I want to acknowledge the land on which I am standing and the wisdom and footsteps that have marked it for generations. I encourage you to do the same. The place where I live and join you from today is acknowledged to be the territory covered by Treaty 6 and Region 4 of the Métis Nation of Alberta, a traditional meeting ground, gathering place, and traveling route for many Indigenous peoples for centuries. By acknowledging this territory, we respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada that enrich our vibrant communities. A treaty is an inheritance, a responsibility, and a relationship. We are all treaty people, beneficiaries of the peace and prosperity the treaty brought, and committed also to working towards the equity and justice the treaty promised. May recognizing our status as treaty people help us to be good neighbors to one another, good stewards of the land, and good ancestors to all of our children. Okay, so getting on to the main event and why you've joined us today. So many of you on the call today may know the Evaluation Capacity Network or are deeply involved in some way, but there are many who might not be as familiar. So I just want to share a little bit about the ECN. We are an interdisciplinary and intersectoral network. We're housed within the Community University Partnership for the Study of Children, Youth, and Families, CUP, in the School of Public Health at the University of Alberta. We support individuals and organizations across our municipality, our province, and nationally across Canada with research and evaluation. So the requests we get can range anywhere from needing the support of a graduate student, help building an evaluation plan, building evaluation capacity in an organization, or taking on the evaluation of a large initiative, and of course, everything in between. So our session today will showcase several of the community-based research, evaluation, and capacity building projects that the Evaluation Capacity Network members are leading across Canada. So project teams have put together some great presentations for your enjoyment today, and they'll provide an overview of each of the initiatives. We'll start with a presentation of 4 community-driven evaluation projects, which will be followed by a moderated question and answer period. Then we'll hear about 3 evaluation capacity building initiatives, which will also be followed by a moderated question and answer period. So all questions for our presenters today can be shared in the chat box throughout the session. I'll post the questions directly to our presentation to our presenters during our question and answer period. So don't hold on to your questions. Feel free to post them as they're coming to mind and as you're hearing the presentations today. Okay, so for the next 12 minutes, I'm going to hand it over to our presenters, but we have recorded the sessions today, and we're going to hear about some community-driven evaluation projects. So these include an evaluation of a school-based support intervention called All In for Youth, two projects about early learning and childcare, one about the journey of newcomer families and the other about workforce stability in this sector. And the final project that we're going to hear from is the New Canadians Health Centre. So with that, I will hand it over to our presenters.
I'm Jessica, and today I will be talking about the All In for Youth project. So, children and youth can experience many challenges that get in the way of their schooling. This includes poverty, unstable housing, lack of nutrition, and personal or family challenges. These can all make it difficult for students to engage in school and to graduate from high school. In response, a school-based wraparound support intervention known as All In for Youth was developed. All In for Youth is implemented in 8 schools in Edmonton in low-income communities, and it has been running for the past 6 years. It provides students and families with support services to help with their everyday functioning and with the goal of graduating from high school. These services include nutrition supports, mentoring, mental health therapy, success coaching, out-of-school time care, and family supports. To understand the impacts of these services on the lives of students and families, we do a program evaluation with developmental, formative, and summative elements. We conduct interviews, focus groups, and surveys with All In for Youth stakeholders such as students, families, agency staff, and teachers, and we also analyze secondary data from All In for Youth agency partners and schools. We recently conducted an evaluation for Year 5 of All In for Youth. For Year 5, we learned that All In for Youth was able to effectively support students and families despite the added difficulties of the COVID-19 pandemic. Agency partners and schools constantly collaborated and adapted their services to make them available and to meet important needs. Specifically, over 90,000 meals and over 90,000 snacks were served. Additionally, over 1,400 students and their families accessed one or more targeted All In for Youth support, such as success coaching, mental health therapy, out-of-school care, or family supports. In fact, a survey at one school revealed that 75% of students felt like they were more likely to complete high school due to these All In for Youth staff and supports. So a helpful tool that we used and recommend for program development and evaluation is a theory of change and logic model. A theory of change states what your program does and what your objectives are. A logic model maps out the steps needed to take for your theory of change. This can help you to determine what evaluation questions to ask to see whether or not you're meeting your program objectives, and also what data to collect and who to talk to. So at the ECN, we have a repository of resources that you can use for this, and the link is on the slide. And thank you so much for listening.
The Journeys project is exploring the needs, aspirations, and experiences of cultural minority families with young children, birth to 5 years old, in community-based early learning and childcare, or ELCC, in Edmonton. The project aims to provide rich information on the lived experiences of families and to provide a space for them to voice their hopes and struggles and to shape solutions. Through the multicultural health brokers, we used purposive sampling and recruited 29 participants for 7 focus groups and 7 participants for semi-structured interviews. The participants were recruited from different overarching visible cultural minority communities. In the interim, we have learned that across all cultures, cultural minority families have similar aspirations, experiences, perspectives, and visions for childcare, encompassing things such as cultural preservation, good morals and values, and affordability, to name a few. Currently, we are mapping out the ELCC journey of parents to better understand their experiences as they find out about childcare, make decisions about the suitability of a specific program, and navigate a typical day of getting their children to and from childcare. Each journey map reflects parents' steps, actions, thoughts, and considerations, feelings and emotions, worries, and concerns. While data collection, preparation, and analysis were crucial ingredients to answering our research questions, the journey map is a powerful tool for uncovering things that the traditional research methodology may not necessarily be able to. The process of journey mapping itself can reveal strengths and gaps in Edmonton's ELCC system to explain families' decision to stay in a particular childcare program or to look for alternatives. It does this by capturing the emotional, mental, and social experiences of individuals and groups interacting with a service or program, and by identifying the reasons or drivers behind why family members and providers respond as they do along the care journey and in transitions in care. These strengths and gaps can be used by policymakers and advocates of ELCC to inform policy to make way for a better childcare system.
Creating workforce stability in the early learning and childcare sector is a community-based project led by the Association of Early Childhood Educators of Alberta, a non-profit, member-based society that advocates for early learning and care educators. AC's vision is to have a well-qualified, well-compensated workforce that is respected as professionals and valued for its work. Their goal is to transform Alberta's early learning and childcare workforce into a recognized profession. In January, 4 Mount Royal University Bachelor of Early Learning capstone students and 1 student from McEwan's Bachelor of Early Childhood Curriculum program joined us on a research journey. The Canada-Alberta Childcare Agreement is investing $3.8 billion into Alberta childcare, and AC wanted recommendations to present to the Ministry of Children's Services. Starting with a rapid literature review, the MRU students created 3 pillars of support for the workforce: compensation, workplace conditions, and educational pathways and ongoing continuous learning. Next, the students wanting meaningful engagement with the community conducted interviews to humanize the last pillar, educational pathways. 6 interviews with early childhood educators resulted in learning stories that outlined the barriers and facilitators they faced and internal motivations to increase their education. These stories are yet to be published on AC's website. We learned that early learning educators are eager to be part of a community of practice and be seen as professionals. Despite the barriers such as time, money, energy, and access to educational programs, they are keen to be knowledgeable practitioners. So now what? The AC project continues as an intern has joined our team, and we conduct more interviews, create an evaluation plan, and continue to uncover how to professionalize a vital sector. A changing context requires the project to remain flexible. We learned how vital ongoing and iterative dialogue is between the stakeholders and the team to gain clarity of all needs. Facilitation of the needs of all stakeholders and community-led research are essential to reach meaningful outcomes which can be used to improve the sector. Hi, I'm Anya, and together with Christian and Augustine, we will be presenting the New Canadians Health Centre project. As of last year, Edmonton was the only major city in Canada without a health centre for refugees. In response to the lack of holistic healthcare for refugees, the New Canadians Health Centre has been established. The centre aims to improve the refugees' well-being and integration into communities by providing them culturally and linguistically competent health services and resources. Fundamental to the center's work are 5 principles: welcoming and inclusive, adopt a social model of health, create a supportive learning community, act collaboratively, and community-owned.
The NCHC has developed partnership with ECN to design and implement a community-led evaluation of the center. This collaboration involves stakeholders including the center staff, members with lived experience, and researchers and students from the University of Alberta. 2 working groups have been defined: The first group is designing a strategy to approach refugee communities in order to collaboratively build a principle-based evaluation network. The second group is developing a framework for conducting research at the NCHC. Our main goal is to ensure the voices of the community are represented throughout the process. We are currently working on an evaluation project aimed at documenting the history and development of the guiding principles at the NCHC. Our involvement with the NCHC has taught us a lot about community-led initiatives. Establishing clear objectives is essential as it allows for efforts to be focused on the needs perceived by all stakeholders. Building team trust is key, but it takes time and commitment. Enthusiasm, energy, and capacity have ups and downs, requiring the flexibility of the entire team. Flexibility is an important feature in these projects, primarily because shared responsibility and control among stakeholders makes the project variable in pace.
Moving forward, the working groups will continue developing an evaluation research framework. Interviews with participants are underway to document the NCHC's history. Once the interviews are completed, they'll be transcribed, thematically analyzed, and the report will be written. Findings of this report will be shared with all relevant stakeholders, including the community, and will feed into the operations of the center. Documenting the development of the center is a contribution to fostering community-based health initiative tailored towards refugee communities.
Wonderful. Wow. Amazing presentations. Each one was so unique and engaging. So I want to encourage those of you that have joined us today to feel free to pop any questions in the chat. I know we had quite a bit of diversity in terms of the presentations. And maybe I'll just get us started with a couple questions. And Jessica, because you went first, I'm really interested in hearing a little bit about the All In for Youth project and how did the COVID-19 pandemic affect program evaluation and the work that you were doing?
Yes, so last year all the evaluation continued despite the pandemic. We moved online, and so focus groups were conducted over Google Meets and Zoom, and interviews were conducted over the phone. And now this year we're actually doing a mixed delivery approach. And so schools have the option to do focus groups in person or online, and individuals can do interviews in person or over the phone. So we're going into schools, we're doing them online, so we've definitely embraced a mixed delivery approach this year.
Awesome, thank you. And maybe if we could just jump over, excuse me, to the Journeys project, and I believe Prime and Peter have joined us today. How have you embodied the principles of community-based participatory research in the Journeys project and the work that you're doing there?
So I'm not sure who wants to go first. Prime, do you want to tackle this or me?
Oh, you can go, Peter.
Okay. Well, I think we've embodied it right from the beginning here. So just to give you a little bit of a sense of where the project came from, I was approached back in November, I think 2020 actually, by the Edmonton Council of Early Learning and Care to look at a process of could we do some journey mapping with newcomer families around their early learning and care experiences. And this was intended to build on research that had been undertaken, led by the council back in 2019. When they approached me, my instant response was, I'm not sure if I'm the right person to be doing this work. I'd be happy to support the work, but I'm not sure if it should be me leading it. And so I reached out to Yvonne from the Multicultural Health Brokers and basically created a relationship right from the beginning. And it's through that relationship that we co-developed a research proposal, a funding proposal that went back to the Edmonton Council of Early Learning and Care. So Yvonne was involved right from the beginning in framing the research, in building the approach. And in fact, they're the ones that are administrating the research dollars because it flowed through the brokers through a contract that they signed with the council. So they've been engaged at each step in the journey in terms of organizing the research, organizing their teams, to helping develop the questions. So I don't know, is that close enough, Prime? Did I miss something?
That's pretty much everything, Peter. And if I may add, why is it participatory research? Like what you said, from drafting, from creating or crafting of questions, the brokers are there, which who are representing the different communities of ethnocultural minorities here in Edmonton. So it's a partnership between three institutions: the multicultural health brokers, ECN, and we also have the insiders from the ELCC system, represented by the Edmonton Council for Early Learning and Childcare.
Great. Thank you so much for sharing that. Well, maybe since we're in the conversation of early learning and care, Mary Frances, I wanted to ask a question about the AC project, and just curious, what role does the government's plan to open up more childcare spaces play in stabilizing the workforce?
Yeah, that's an ongoing iterative conversation. I think that needs to happen right now. It's kind of a complex agreement, and the agreement hasn't been posted on their website yet. So we're not quite sure what the details are, but we suspect, just talking to many different kinds of stakeholders, what the process is going to be about. There is an agreement in there that there has to be some pathways to education, increasing the levels of certification. So there's a few things that we do know. And so working with AC and some of their stakeholders is we're hoping to build some capacity so that we come with really research-based information.
Wonderful. Thank you for sharing that. And maybe the last presentation that we heard from was the new Canadian Health Center. So very, very new center, opened its doors in September. Really, incredible opportunity within the city of Edmonton, but also just in terms of learning and walking alongside this. And I'm just wondering, I believe Augustine and Christian, you're joining us today and you're doing some work with NCHC. What advice do you have for building trust with community partners, stakeholders, and how will you ensure that the voice of the community is represented through the evaluation work that is done with the NCHC?
Well, Christine, you want to take this and I jump in, or you want me to go?
Oh, you go first, please.
Okay, so building trust requires, with these communities who have gone through a lot of difficulty just before they arrived in Canada, requires a lot of patience, understanding their background, where they've come from, and then knowing that we need to provide them with some care and support, right? So it requires a lot of patience with the communities, so you can understand what their needs are. Then understand their needs also requires that you help them move to the next step of integrating into the community. And that means providing them with that wraparound service that they need. For example, where do I go to get healthcare after this? What sort of service do I need to get in order to better integrate into the community? All of these are important in helping the community that the NCAC is serving. Christian, anything to add?
Yeah, in order to gain trust and build trust, I think it is very important, something that is quite difficult usually for researchers and clinicians, which is let go of control and let the communities that are working along together to decide to elaborate their own way of doing things, and just let that happen, which is very difficult, as I said, for researchers and clinicians. And of course, cultural humility is very important. And also, in order to build trust, we need to build reciprocal relationships. It's all about giving and sharing as well.
Great, thank you. We have a shy audience today in terms of questions. Please feel free to pop any questions. I mean, of course, these projects are very diverse and unique, but if you've got any questions, maybe I'll ask kind of to all of our presenters today, what is your role in these projects? So where are you kind of coming from in each of these different projects? I know some of you are students, and how did you get connected?
I can go again. Sorry, it feels like somebody needs to break the silence here. So I'm actually a postdoctoral fellow with the Evaluation Capacity Network. And in my previous life, I've spent a lot of my career doing facilitation work and human-centered design work. And so I think I was originally brought into Journeys came about largely because people reached out to me to see if I can help facilitate this process. And I would say my role really has been one of a facilitator so far. I mean, I've tried to support the process where I can, help develop some ideas, but it really is being led by the community. And my role is to be responsive to their needs and to jump in where appropriate to help sort of create conditions for dialogue. But I think I'm still playing the facilitator role, although it's a facilitator / researcher role that I have at the moment.
And definitely, I think those go hand in hand, Peter.
Yeah.
And we have a couple of questions that have come in, but maybe I'll just let our audience know that many of you are graduate students that are pursuing Masters of Science, Masters of Arts and Community Engagement, doctoral programs in evaluation. So, you know, quite a keen interest, but really foundationally interested in working in community with community on community-based issues. And I think that really speaks to the presentations today. I'm just going to go to a question in the chat from Leslie, and I think this is for the Journeys project, specifically around journey mapping. Do you have any helpful resources that you could consult, particularly concerning its use and evaluation? Are you leaning into a particular resource or a framework that you're using for journey mapping?
Prime, I don't know if you want to jump in here. I'm going to give you.
Oh, please, Peter. I know you are more knowledgeable about the journey mapping. Yeah, you created that yourself.
So our journey mapping really has been inspired mostly by the journey mapping approaches that have been used in service redesign. So journey mapping, I think, has traditionally been used when you want to take a human-centered approach to looking at the experiences of people as they go through a service or a program. So many of the examples of journey mapping available out there really come from the domains of healthcare and other spaces like that. And there's some examples of journey mapping being used in education spaces to look at, for example, the experience of students in a school. Or so we really drew inspirations from those domains. And what we also then did was, our journey mapping was really informed by the focus groups and the one-on-one interviews. That's the foundation of our work, has been direct conversations with families. And it's from those experiences that we then built from those experiences to do the journey mapping on top of that. And I would say the interesting innovation in our approach has been that we've had to do this virtually. Like typically journey mapping happens when you're able to put a big piece of paper on a wall and you're working with the community to map their experiences on a big piece of paper. Now, we weren't able to do that, obviously, because of COVID. And so we had to adjust our methods to do that in a virtual environment. And then what we've done after the journey mapping is then redraft those journeys back into a narrative form. So we went from stories to a visual representation of people's experience, and then from that back into story. And so far, I think it's been very, very powerful and a very effective tool for sort of showing lived experience.
That's great. Thank you for sharing, Peter. I won't ask the question in the chat, but maybe if you or Prime can respond to Debbie, because she's offering up a lot of resources there in terms of some programs that they fund. So if one of you could sort of respond to Debbie. Just another question, maybe this is to the larger group and you can decide who wants to take this, but how do you encourage folks to participate in research or evaluation data collection? So how do we make them feel safe in that process, heard in that process? So I think probably in that question, getting at participants themselves. And I know, Jessica, in your project, you're trying to engage youth, you're engaging families, you're engaging administrators in schools. Of course, in the NCHC, you're engaging, refugees. You may be engaging health providers and AC, you're engaging educators. So if any of you wants to take that on. Very diverse kind of participants, but of course, what does it take to get them encouraged and engaged in that process? Or what are some of the things that you've had to do, some of the strategies perhaps?
Well, if I may jump in here, I would say oftentimes it's about letting them understand what the project is about, what are the aims and objectives, and as has been mentioned by Chris, letting go of control, letting them know that we are all here on equal levels to learn from each other. You coming in with a academic experience, they come in with a lived experience, so you join forces together to make sure that things go the way they're supposed to go in terms of the achieving objectives of the research or the evaluation. And then you also involve them in how the questions are developed, evaluation of research questions are developed, and the entire process. You involve them in the entire process from start to finish, and also to the dissemination of the findings.
Yes, I would agree. Working with youth, often their parents sign the consent form. And so it's important to share information so they know what the project is about and make sure that they're happy to participate. And so as Augustine said, it's kind of empowering the participant with knowledge so they can make choices about whether to participate.
Wonderful. Thank you, Jessica and Augustine. So I want to thank our presenters for the community-driven projects, for joining us and sharing your expertise and your wisdom. There still are a number of questions in the chat, so perhaps while we move to the next section, which is about evaluation capacity building, some of our presenters might be able to respond to those questions. So just moving along in the interest of time, so we're going to shift gears a bit for the next approximately 9 to 10 minutes. We're going to hear about some evaluation capacity building projects. So the first initiative is a learning partnership between Queen's University and the University of Alberta. The second is offering unique evaluation capacity in partnership with the mentoring sector. And finally, we'll hear from our colleagues at the University of Ottawa offering participatory evaluation training for community-based organizations.
As we have all experienced, COVID-19 flipped our world upside down. This included organizations offering services to youth and families like mentoring. After having staff participate in E-Eval, the Alberta Mentoring Partnership initiated a partnership with the ECN. The goal was to build the evaluation capacity of mentoring organizations so they could use evaluation to develop and implement high-quality, evidence-based virtual mentoring programs. In response, we developed and ran E-Eval, a 6-month virtual course offered to mentoring organizations. It included synchronous learning sessions, individual coaching, and a resource website. The intent was to build 6 organizations' evaluation capacity by supporting them in planning and implementing a culturally appropriate, community-based evaluation. In evaluating E-Eval, we found that the organizations who joined E-Eval already had mid to high evaluation capacity at the start of the course. In response, we developed and implemented Pre-Eval, an 8-part webinar series with monthly webinars on introductory evaluation topics. In addition, a resource website and individual coaching was developed. The intent was to reach more organizations with lower evaluation capacity by creating a less time-intensive, more introductory webinar series.
We have 3 main takeaways from these projects and our data collection. First, co-learning with other organizations with similar contexts was highly beneficial to learners. Second, evaluation capacity building in communities needs to be responsive to organization needs. Every time we've made a plan, we found a need to shift. For example, E-Eval didn't reach lower capacity organizations, so we developed Pre-Eval. Third, engaging organizations with lower pre-existing evaluation capacity in evaluation capacity building is difficult. We suspect this is a combination of burnout from our new virtual worlds and organizations perceiving themselves as lacking resources, skills, knowledge, or motivation needed to engage in these opportunities. Based on what we've learned, we have some next steps for evaluation capacity building initiatives. Those who are more interested in evaluation are the ones that typically seek out these learning opportunities, while those who aren't interested or skilled in evaluation often do not have the time, confidence, or motivation to engage with capacity building opportunities. More efforts need to be made to target beginners and low capacity organizations. Ensuring that all capacity building initiatives are responsive to the needs of each individual organization will increase the likelihood that lower capacity organizations can and will engage. In a virtual world, this might look like ensuring meetings, videos, and content are short and to the point. Finally, co-learning with other individuals with the same level of capacity and similar contexts creates connection, builds confidence, and results in meaningful learning that is applicable to real-world programs. In the end, such initiatives have the capacity to put evaluation in the tool belt of youth-serving organizations so that these organizations can provide much-needed, effective programs. Thank you.
Hi, I'm David, Research Associate at Labo-Eval here at U Ottawa. It's my great pleasure to share with you an approach we use to make our basic training and evaluation more fun, practical, and relevant for community-based organizations. Over the last decade, we've seen a growing number of training programs that have been developed to support and build evaluation capacity in community-based organizations. However, evidence shows that these programs sometimes are not being transferred into real-life environments and do not result in sustained evaluation capacity in those organizations. One potential reason is that these trainings are often based on an expert-led curriculum development approach. In other words, evaluators tasked with training CBOs determine the content and the methods to be included in the training. Consequently, some training programs might not reflect the needs and interests of CBOs, which can impede their motivation and knowledge retention. So, what did we do? We used a participatory curriculum development approach to engage potential users from the community sector to develop our basic training and evaluation. By using this approach, we hope we could design a training that will meet the needs and the realities of these organizations. To do this, a steering committee with representatives of CBOs was formed to develop a detailed training curriculum and identify promising learning methods. So, what have we learned? We learned that by using a participatory development approach, we can better integrate the realities and the needs of participants into the training. As you can see on this table, the community proposed various materials and tools to make the process, or the evaluation process, more effective and fun. These includes, for example, a facilitation kit for a group data interpretation session, an evaluation capacity building modules, short informative videos on different aspects of evaluation and evaluation capacity building. So where do we go from here? Clearly, stakeholder engagement in the design of our training was a positive experience, which led to improvements in terms of material and content. However, we still need to evaluate the training in order to see if it's effective in building evaluation capacity in the long term. Also, how can we better engage stakeholders in the training development process? Clearly, we use an approach that is closer to consultation than genuine participation of various stakeholders in the process. More studies are needed to understand best practices and benefits of engaging these stakeholders in the development of training.
Wonderful. Thank you again to our presenters for sharing unique and engaging presentations. So I think I'll get the question period started again. And actually, I want to go back to a question actually that was asked in the earlier piece. So each of the initiatives that were just shared really focus on formal, informal evaluation capacity in terms of learning. And I'm sure that this is likely part of your training, and a question from earlier. In what ways do you report successes in areas to explore back to community, just in the work you're doing? Or how do you support community organizations in doing this? Or what elements of your training would support this direction? So I think I could probably open it up to any of you. David, you had gone last, so maybe, I don't know if you have this embedded right in your training modules, that idea of evaluation, kind of reporting and use. How do you get organizations to report in ways that the information is used?
For sure, I think it starts with the interpretation part of the evaluation. When you're engaging all the stakeholders, for example, directors, social workers, and more clients into the interpretation part of the process, I think it's really engaging for them to be part of it, and then they will most likely will use the results for improving services, for example.
And what about the other groups? Do you have certain strategies you like to use in your training or for reporting back to community when you work with community?
I'm happy to go with this one, Rebecca, because it's something that we think a lot about in our work. And I would say that there are three main considerations. And one of those is initiating conversations early about the concept of audience and who are the audiences for this work and how do we need to reach them. And in doing so, we recognize that we might need a variety of reporting formats in order to reach diverse audiences. And so that might include things like plain language summaries, infographics, videos like what you've seen today, slideshows that are annotated for our community organizations to assist them with presenting those. And after we've thought about audiences and we're thinking about the communication pathway, so it's often not enough just to create the reports, but we also have to think about, just like we would with survey design, how do we get it out there? How do we push? How do we pull? How do we create loops for feedback to understand how it's being reached? So we've done that by embedding QR codes and embedding surveys so that people who are looking at the resources can give feedback on the resources or enter draws to incentivize people to look at and use the resources. And I guess I've already talked about diverse modalities. So those are my three for thinking about use and reporting.
Awesome. I don't know if others have anything else to add, but of course I have more questions to ask. I'll just leave some space. Okay, I'll ask my next question. So each of you are involved in formal, informal. I mean, from the descriptions, you've got like curriculum that you shared with us. Are any of these resources accessible just to the general public? How might we access them? And then are some of them like you need to actually formally sign up for this course or this training? So I know that's a fairly large question, but I think probably our audience is wondering, how do I get my hands on this stuff? So maybe Kirsty, do you want to share a bit about Pre-Eval and E-Eval and how folks might get access to some of that information or sign up for a future offering?
Yeah, for sure. So Pre-Eval and E-Eval, E-Eval is offered specifically to organizations who are partners with the Alberta Mentoring Partnership. Now they are also expanding their partnership. So if you are interested in accessing a lot of their resources and you're not specifically a mentoring organization, but you engage in some sort of mentoring within your organization, even if that's not your main intent, you can become a partner with the Alberta Mentoring Partnership. In terms of Pre-Eval, actually anybody can access that at any point in time. It's freely available on the internet. You just have to sign up for our resource website. And I will put the link to where you can access those webinar recordings in the chat. People who watch all 8 actually get a certificate of completion. So you get to kind of demonstrate that you've gained this evaluation knowledge.
Great. Thank you for sharing that, Kirsty. And David, what about connecting with your gang at the University of Ottawa?
Yeah, so all the training material and the training content is in French right now, but it's getting translated in English. I think within maybe 2 months it's going to be all available. So also I'll share with you the email so you can write to us, and I will gladly share the material with you when it's ready to be used. And just to jump back to the other question about reporting, I think, as Michelle said, there's many ways to report results than report, like a big report. And there's also a module in our training that is that has like ready-to-use template, for example, infography, short brief report, policy notes. So there's many ways to connect people to share the results with other stakeholders as well. Will be available in English as well.
Wonderful. We look forward to seeing that, David.
Yeah.
So I'm sure you'll get some emails after the fact, probably for French resources, because those are not always easy to come by, but also English resources as well. Katrina and Nick, I don't know if you have anything to add.
Yeah, I can just quickly speak on what David and Michelle were talking about sharing information with stakeholders and organizations, just ensuring the accessibility of those reports is high, making sure that there are ways for people to access them. If it's a video, make sure that the audio is high enough, make sure that there's some sort of transcript that is accompanying it as well. And just making sure that the equity and diversity and inclusion of the reports is high enough, and make sure that that is accessible to everyone around there.
Great, thank you, Nick. Debbie has a question, because some of these learning opportunities are an investment in time, of course, and we know that many organizations are limited in their time and capacity. Can one of these, can an organization book, or individuals, a collective of individuals, book some time or space and just do a 3-hour workshop versus kind of commit to the whole, it sounds like, Kirsty, you mentioned these are available online, do them at your leisure. But if somebody wanted to sort of have, we want to get our organization together because we see some value in that learning space, how might they go about that? I see, Michelle, you popped in a link in the chat as well. So
yeah, and for sure, I would say that these webinars are recorded, and you could even pick 3. They're chunked into topics, so you could even pick 3 of those, for example, and watch them as a team and engage in some discussion about it. I think that is a really critical part about learning about evaluation, is that collaborative learning and talking about it. But if you are looking for a more individualized support, which is something we kind of touched on in our video, is the importance of that. and how important that is to engage different organizations is you really need that individualized support. AMP offers individualized coaching sessions actually, so you can book them for your organization. For example, you can come with, hey, I want help on this topic, and you could book for your organization, bring as many individuals as you want to discuss that topic specific to evaluation with your organization.
Wonderful.
I'd like to just throw a pitch in as well that another way to bring some evaluation capacity is to work with graduate students in a less formal way who can assist with delivering these short course experiences or helping the resources that exist within our various networks to get to the table in your organization. But they can also offer a more sustained commitment and receive course credit through it. At Queen's, we have internships, which do not have to be paid, but they can be. And we also have independent study options. So there are certainly ways to meaningfully bring in evaluation expertise in a very choose your own adventure kind of approach.
Great. Thank you so much for sharing. I'm not sure if we've got other questions in the chat going, but maybe I'll just pose one to Michelle, Nick, and Katrina, because I know you're about to launch the 4th iteration of, E-Eval and Q-Eval. That's the cute name for the University of Alberta in Queens. And what do you find to be some of the most rewarding aspects of offering these learning experiences with students on campus, but also in partnership with community organizations? What is some of the most rewarding? And maybe perhaps people want to hear what's the most challenging?
Yeah, I can definitely speak on this. So this is my 2nd year working with the E-Eval, Q-Eval partnership. And yeah, some of the, it's hard to nail down one specific reward that we can really talk about. I mean, when we first start the week intensive, we have students and community organizations coming to us and saying, I don't really know what evaluation is. I've heard of it. The person down the hall does it, but I'm not really sure what they're doing on a daily basis. So just coming and seeing the progression that they make throughout even just 5 days, this 5-week intensive is phenomenal and honestly outstanding. It's just like we start and we kind of preach that throughout the week intensive as well as the pre-institute as well, to say, we all started where you are right now. We all at one point didn't know what evaluation was, how we get to the point from I have this idea of I want to send out a survey and I want to use the data meaningfully to improve my program. Everyone started at that beginning point, and now at certain points, Rebecca and Michelle, for example, started where they are, and now they're running courses and they're mentoring students like myself and Katrina on how to improve their evaluation skills. So I think that's just one of the most rewarding aspects. In terms of challenges, of course, moving on to the online perspective of the course, we would ideally like for it to be in person, but without the online aspect, the Q-Eval, U-Eval partnership maybe wouldn't have come to a fruition. So yeah, there's definitely more rewards than challenges. I mean, personally, one challenge for myself is I get very invested in the program and in the evaluations, and it's sometimes difficult to let them go after the 5 days because I want to see what this evaluation plan is going to result in, how are they going to improve. So yeah, those are just a few rewards and challenges on my part, but I'll let Katrina speak up as well.
Yeah, for sure. Thanks, Nick. Something that this is my also 2nd year working with U-Eval, Q-Eval, and just thinking about the rewarding experiences from the learner or the student perspective is that this is a really meaningful, authentic learning opportunity for students. Students build the foundational knowledge of evaluation, which can be overwhelming at first. There's a lot of theories and methods. But what Q-Eval, U-Eval does is it actually allows students and learners to put what they've learned into practice on a real world case application, which is extremely meaningful. And then just in terms of challenges, I think Nick mentioned quite a few of them that came to mind as well, but it can be challenging online. The week intensive is of course intensive. There's a lot to do during that week. And so just thinking about some of the responsibilities outside of that as well might be a challenge.
Great. Thank you so much, Katrina and Nick. Maybe I'll just pass it back to David. I know you work with lots of community-based organizations at all levels, probably very grassroots to maybe even up into the government space. And we did have a question earlier, is kind of going back to that reporting piece around how do you actually meaningfully engage some of those organizational partners that do work a lot with government, right? And they may have reporting requirements to government. So how do you meaningfully engage them in that process, reporting in that process, so that it is actually sustainable? I don't know, big question
Yeah,
to wrap up this session.
I think it will really depend on who's sitting on around the table when making up the evaluation plan, going to the methodology, writing the results, everything. I think it's the best way. I think it's really to make it participatory, meaning engaging people the best way you can, sometimes by providing resources, working at night because it's easier for some groups, for example, to meet at night, or it's being very flexible on your methods and the way you engage with them, and think about the process as how can I make the most out of it. But I'm sure other people also have ideas on how to engage
Sure. Maybe I'll just
participants.
open it up to the group before we wrap up, if anybody else wanted to tackle my final question. For those of us in Alberta, stomachs are growling. We're ready to get on with our lunch if you weren't able to eat it while we were here. Well, I do, we are coming to a close, but I do want to thank all of our preventers. You're not our preventers, you are our enablers and our presenters for joining us today. And I want to thank all of our participants that joined us today in our conversation and posed some really interesting questions. As I mentioned earlier, the slide deck and the video recording will be shared to your email within the next week. Of course, we're interested in understanding what you liked about the session, what you'd like to see in the future from the Evaluation Capacity Network. And so a little link is going to show up in the chat that is an evaluation survey, and you can share your thoughts. We've also put a resource list in the chat that came from those conversations today. And of course, I know lots of people were putting their emails in there and some different links, so we'll make sure that we follow up with that as well. So with that, I want to thank everyone very much, and I'm wishing you a wonderful rest of your day.